now?
Yes.
Okay. First, I'll be walking through your network access. The second portion will be your plan specifically for 2017. And then last, for tools and features, my colleague Rob will be going through the third section. So let's begin with network and access. So if you're all familiar, you do currently have the BPO Premium Network. This is our broadest network at UPMC Health Plan. It exists in 29 county service area. Most of the UPMC providers and owned facilities are within this network, and many community providers and facilities are in this network as well. The new option for 2017 is the HMO Standard Network. Now this is with a referral product. This is in 28 county service area. The one county that is missing is Center County. Again, it has most of the UPMC providers and physicians in this network, and many of our community hospitals as well. We'll get into the details of the HMO referral product here shortly. For the PPO out-of-area network, we use a national network called PHCS, the multi-plan network, which exists in everything outside of Western Pennsylvania and Ohio. It has around 5,000 hospitals, 27,000 ancillary facilities, and 750,000 healthcare professionals located around the United States. The national network that exists for the PPO out of area in Ohio is Medical Mutual, which we call MMO of Ohio, which has 163 hospitals, 14,000 primary care physicians, and 54,000 specialist practitioners. Assist America. Assist America, you have currently with your existing plan. It's an added service for when you're traveling and have emergencies, because they can happen anytime, anywhere. Assist America will help cover, they'll help medical consultations. They'll help coordinate benefits if you do end up in an emergency. You're away 100 miles away from home. I know I've utilized it when I was in Hilton Head on vacation and just wanted to make sure my benefits were coordinated when I took my son to the ER. Paid the copay that I had, and everything else was handled appropriately. So it's always nice to carry this number with you. It is located on upmchealthplan.com. I carry it with me with my member ID card when I'm in the States, and if you're traveling out of the country, you can call this number as well. They can help with medical, if you need to be transported from country to back home. They can help with medical transportation, lost luggage and document assistance, and they also help with care of minor children as well. There is the number listed below, if anyone wants to write it down. It's an 800 number. It's 1-800-872-1414. But again, it is located on upmchealthplan.com. The out-of-area coverage for the PPO and HMO, like we just discussed, the PHCS and the MMO network, this is available for dependent children living and attending school outside of the Western Pennsylvania area. So they have access to both networks, whether they're living in Ohio or outside of Ohio and Western Pennsylvania. The HMO dependents do not need a specialist referral, and we'll get into that here in a little bit when you're on the HMO plan. Students may also use on-campus student healthcare centers. There's no restriction for any of the plans, for either of the plans, if they use the health centers on site. It started this year, but going forward in 2017, parents do not need to notify the health plan that their dependent is a student, because we cover with the national network all dependents up to the age of 26. So you no longer need to identify if your child is a student. And again, the national networks for both PPO and HMO cover emergencies at the highest level within the United States, regardless of the provider. Our pharmacy network, we have more than 30,000 pharmacies nationwide. There's not really that has changed for 2017. We still have Giant Eagle, Rite Aid, CVS, Target, Kmart, Walmart, and Sam's Club in our network. Any questions on the network portion of it before I move on to your plans for 2017? Yes.
If you were out of state and you forgot your medicine and you went to one of those participating pharmacies, are you still in network even though you're out of state?
Yes. Yep. So for your plans for 2017, like I mentioned before, you have two options this year. You have the 2017 Premium Network PPO you have the HSA and HRA options for each of the networks. So for the PPO 2017 network, your deductible is $4,500 for individual, $9,000 for family. Your out-of-pocket maximum for 2017 is $6,450 for individual and $12,900 for family. Now I do want to note this year the way that your deductible and out-of-pocket max accumulates is different than it is for 2016. So for 2017, it will be changed to an embedded deductible and an embedded out-of-pocket maximum. And what that means is that one individual, whether you're on an individual coverage or family coverage, cannot exceed the individual deductible of $4,500 within your plan. So for instance, I have a family plan. It's myself, my husband, and then my child. If I am a high-cost claimant, I accrue most of the claims in our family, even though I'm on a family contract, and my family deductible is $9,000. Me as an individual cannot exceed the $4,500. So once I hit that max of $4,500 for the deductible, my co-insurance will start accruing to the out-of-pocket maximum. And then my husband and son will make up the remaining difference for the deductible. And it's the same thing for the out-of-pocket maximum. It's embedded out-of-pocket maximum. So me accruing a lot of the claims, once I hit the $6,450 individual out-of-pocket max, the plan covers. And that includes your deductible, co-insurance, and if you have co-payments as well. The 2017 Premium Network PPO has an out-of-network coverage, as you're familiar with for your 2016 plans. Again, this is our broadest network. No referrals are needed for the PPO plan. And then most preventive care covered at 100%. We do have the schedule and the preventive guidance online for age range with different preventive services and when it's covered at 100%. You can visit UPMChealthplan.com and find that information. Moving on to the new HMO Standard Network plan that's available to you for 2017. This has a $3,000 individual deductible, $6,000 family deductible. Your out-of-pocket maximum is $6,450 individual and $12,900 family, same as the PPO. And again, for 2017, this will be an embedded deductible and out-of-pocket maximum. So that means one individual, again, cannot accrue more than $3,000 for an individual deductible and $6,450 for your out-of-pocket maximum. And that's whether you're on a employee-only plan or a family plan. With the HMO, there is not an out-of-network coverage. So you have to utilize all participating providers, which we'll go through how to find these providers on the HMO Standard Network. This is a referral network plan. So what that means with any in-network specialist, diagnostics, or treatment services, with any in-network specialist or diagnostic services, you need to receive a referral from your PCP. This referral will last 90 days, and after those 90 days, you'll have to go back. If you need to see the specialist for more than 90 days, you would need to go back to your PCP to get another referral for an additional 90 days. So the referrals last for 90 days. And that's for any specialist or diagnostic services. If you do not receive a referral for these services, the service that you get at the specialist or diagnostic services will not be covered at all. So you would get the full billed amount from the specialist. And we'll walk through how to do that. And again, under most preventative care, depending on the schedule and the age, it's covered at 100%. So the benefits of having the HMO, you will have a PCP to help guide you and coordinate your care. They'll help refer you to these specialists and provide insight on which specialists to use. Your PCP is essential to ensuring that you get the care you need when you need it. A PCP selection is required for the HMO plan. So you have to identify, and we'll walk through how to identify it through the health plan on who your PCP, who you elect your PCP to be for the HMO network. Make your PCP selection include under enrollment application, but we please do ask that the PCP number is listed. And then also there's a couple of items here. Partnering with your PCP achieves two main objectives: maintaining your health and also improving your health. So how to select a PCP? There are 3 ways that we can do it. You can find and filter providers under UPMChealthplan.com. You can select a provider in the My Health Online, and then you can also call the healthcare concierge team, the number on the back of your card, and just let them know who your PCP provider is, and they can identify it in our system for you. So here's how you find a provider. If you go to UPMChealthplan.com, you will notice there's a little doctor's icon right here. So what you would want to do, once you find that icon, you will select medical. Once you select medical, it'll take you to a new page, the upmchealthplan.com/find. And here's where you can drill down into specific physicians, facilities, and even get down deep into particular specialists. So with yours, you would probably mainly be under the medical section and then either the behavioral health section too, minus the dental and routine vision. You can type in your provider's last name or physician practice right here. Or if you don't know or don't have a PCP selected currently, you can enter in your city or zip code and select how many miles away from that particular zip code or city that you would like to travel, and it would give you a whole list of physicians in that area. One thing that you do want to make sure that you select on the next portion is coverage type, and you will always select coverage through your employer, right here. And then the plan name would be Standard Network Plans, HMO Plans. If you desire, you can filter by type of provider, specialist, hospital privileges. You know, if you want to use a specific hospital, you want to make sure that doctor has privileges to it so they can admit you. Languages, gender, and medical homes. After you identify your filters, all you would need to do is click Find a Provider Now. So based on the search, just pretending we did a 5-mile radius search to see what physicians are in the area. As you can see, it lists out a few here on the page. You want to make sure, and I'll show you on the next page, but once you click on a provider, there will be a check mark if the provider accepts the standard plan HMO, and if it does not, there'll be an X by the standard plan HMO, and we'll see here in a second. All you would need to do is expand the physician right there. So with this physician, John Doe, we are looking in the Canonsburg area, and you can see down below, it has plans accepted. On the left-hand side, it has a check mark by Standard Network Plans, HMO plans. And it also has a check mark by Premium Network Plans, the PPO plan as well. Please note, if it was not, we'll see on the next page, but if it was not plans accepted, it would fall under plans not accepted on the right-hand side, and there would be an X, red X, by the plan that was not accepted. But please also note that you want to look at each particular location separately, because some provider locations have access to the HMO network standard plan, and some do not. So you want to make sure that you drill down by the location that you are receiving services. So just in this example, so for the Canonsburg location, the standard network plan HMO was accepted. But when you look for the same provider in the Steubenville location, the standard plan HMO plan, standard network plans HMO plan is not accepted. So make sure that you take your time and drill down into the location specifically. And if you have any questions, you can always call the number on the back of your card, because they can help you walk through this as well and even find the provider for you. The second way to select your UPMC Health, your PCP, is to go to the My Health Online. And you will find under there, you will notice you can just enter in the last name of your PCP here, a number, if you know it, and then just click this is correct. And sometimes if you already have a PCP, this box right here will already be generated. So if if the correct PCP is listed in that box, all you would need to do is hit this is correct. If it's not listed or if it's not correct, you would just need to update it and then click this is correct. And again, you can always call the healthcare concierge team because they can help put this into the system for you. You can see the times we're there from Monday through Friday, 7 a.m. to 7 p.m., Saturday hours, 8 a.m. to 3 p.m. And then you just want to notify the concierge that answers the phone that you are going to be a member, if you choose to, in the HMO plan, and then they can help assist you. Here's additional information on the HMO referral plan. You do not need a printed copy of the referral. Once you go to the PCP, all of the PCPs in the network are trained on this plan if they accept this plan, and they will put it into the system and it should be generated for you. But we always recommend to check that on My Health Online there's a referral section. You want to make sure that the doctor, the specialist that you're seeing, you see the referral there, because if you happen to go to the specialist and the referral isn't listed, again, it will not be covered. So you just want to double check to make sure your physician is doing what they're supposed to be doing and that the referral was submitted for you. The referrals will last for 90 days, and the referrals are not required for pediatric specialists, OBGYNs, mental health professionals, emergency care, and urgent care. And then members under the age of 21 will not need a referral as well. Like I was mentioning before, if you do have a referral and your physician, put it through the system, you can go to My Health Online. If you, look on the left-hand side of the page, there's coverage and benefits. Then right under there, you'll see your referrals. Once you click on your referrals, you will see this copy right here of this, the referral number, the physician that they're referring you to. And if it's not here, you want to make sure and call your physician to make sure that they get it in, or you can call the UPMC, the health plan concierge as well. So for new members of the HMO, we are going to give you a 60-day transition of care grace period. So for the first 60 days of 2017, you will not need a referral to see a specialist. There'll be a grace period. But we do recommend in that time period that you do visit your PCP, make sure that the referrals and the documentation is in place after the 60-day grace period, so you can continue seeing your specialist for the next 90 days. Then for the Take a Healthy Step and Earn Rewards, the wellness incentive for 2017, if you complete your Take a Healthy Step requirements, is $500 for an individual and $1,000 for your family. So those requirements are a biometric screening, a My Health questionnaire, and you have to earn 300 Take a Healthy Step points. And just to let you know, your spouse, if you are on a family contract with a spouse, they do have to complete the biometric screening and the My Health questionnaire, but not the Take a Healthy Step points for next year. And this must be completed by both employees and spouse by the end of October 31st, for the 2017 funding of the 500 individual and 1,000 family. So both plans still have the HSA will be options on both plans that are available. It's administered through the Keystone Funding Credit Union. And then they do have the HRA as well, which is administered through UPMC Health Plan. Any questions on the year plans? Yes.
I have a question about specialists.
Sure.
If you already are established with a specialist, do you still have to get your PCP's referral regardless?
Yes.
Okay.
Yes. And it will be every 90 days too.
Okay.
Do we have to reapply to the HSA this year, or if we're already on it?
No.
No.
Just continues?
Any other questions? Alrighty. Well, thank you very much for your time, and I'll be around, so if you want to speak to me one-on-one, I'll be in the back. Thank you.
Thank you, Casey.